When providing care for individuals with developmental disabilities, direct care staff must recognize the significant role culture plays in shaping a person's experiences, values, and health beliefs. For Native American individuals and their families, particularly those belonging to tribes like the Sioux, Cheyenne, and Arapaho, understanding cultural nuances isn't merely beneficial, it's essential. Care that integrates cultural respect not only improves outcomes, but also builds lasting trust, dignity, and cooperation between caregivers, individuals, and their communities. One fundamental aspect of culturally respectful care involves appreciating the holistic worldview common among many Native American tribes. Unlike approaches that separate physical, mental, and spiritual health, Native American perspectives typically view these as interconnected parts of a greater whole. For example, wellness is often seen as a balance between a person, their community, and the natural environment. Consequently, direct care staff should strive to understand and incorporate these dimensions into their care strategies, recognizing that honoring the spiritual and emotional well-being of an individual is just as crucial as addressing their physical and developmental needs. Respect for elders is another core cultural value among Native communities. Elders are traditionally viewed as sources of wisdom, guidance, and cultural continuity. Their influence in family and community decisions can be substantial, especially regarding the care of family members with developmental disabilities. Direct care providers must approach elders respectfully, valuing their perspectives and being patient listeners. Building authentic relationships with elders can provide invaluable insights into culturally appropriate care practices, contributing to the overall effectiveness of care plans and interventions. Communication styles among Native American individuals may also differ from those commonly employed by direct care providers. Silence or pauses in conversation might be seen not as awkwardness or confusion, but as respectful listening or thoughtful reflection. Additionally, avoiding direct eye contact, particularly with figures perceived as authority, can signify respect rather than disengagement. It is crucial for care providers to remain flexible, observant, and patient, adapting their communication approach to match the comfort and preferences of the individuals and families they support. Acknowledging and supporting traditional spiritual and healing practices is an essential element of culturally respectful care. Practices such as smudging ceremonies, sweat lodges, prayer circles, or consultation with traditional healers or medicine people can be deeply significant and healing. Care providers who embrace and advocate for these practices demonstrate genuine respect for the individual's identities and beliefs, fostering trust and a deeper therapeutic relationship. By validating traditional healing practices alongside conventional medicine, caregivers empower individuals and families to engage more fully in their own care. A critical cultural consideration when caring for Native American individuals and families is understanding historical trauma and its ongoing impact. Native communities have endured colonization, forced relocation, cultural suppression, and systemic injustices. Such historical experiences continue to affect perceptions of healthcare and governmental institutions, often resulting in justified mistrust or cautiousness. Direct care providers must approach these dynamics with sensitivity, transparency, and patience, recognizing that trust building requires consistency, authenticity, and a genuine commitment to addressing the individual's cultural, emotional, and physical needs respectfully. Family and kinship systems in Native American communities frequently extend beyond immediate relatives to include extended family members, clan members, and close community relationships. Care decisions are commonly made collectively, involving input from a wide circle of family and community members. Understanding and respecting these broader family structures is essential for effective care. Providers must actively seek out family input and ensure that their voices meaningfully shape care decisions, promoting a stronger sense of inclusion and partnership in the caregiving process. a deeper understanding of tribal sovereignty and distinctiveness also strengthens care delivery. Each Native American tribe is an independent nation with unique laws, traditions, and cultural norms. For direct care providers, learning about local tribes, such as specific traditions and protocols of the Sioux, Cheyenne, or Arapaho, demonstrates respect and commitment. Asking respectful questions and remaining open to ongoing learning are essential skills. Providers should never assume universal practices or beliefs across tribes. Instead, they should acknowledge individuality within cultural frameworks. Imagine a scenario involving a Cheyenne family with a young son who has autism. Initially, caregivers notice the family seems reluctant to participate in standard behavioral therapy sessions and becomes withdrawn during consultations. After gently asking about cultural needs, caregivers learn the family prefers involving their tribal elders and practicing traditional ceremonies such as smudging and prayer as part of their son's daily routine. With this information, caregivers integrate these cultural practices into his care plan, arrange regular elder visits, and create space for ceremonies. Soon, the family engages more comfortably, trusting staff members more deeply, and their son's anxiety significantly decreases. This scenario exemplifies how culturally responsive practices lead to improved outcomes and stronger relationships. Ultimately, culturally respectful care involves ongoing education, humility, openness, and flexibility. Direct care providers who embrace cultural competency commit themselves to lifelong learning, recognizing that true competency involves continual engagement, curiosity, and respect for the diversity within Native communities. Providers who actively integrate cultural knowledge and sensitivity into daily practices contribute profoundly to the empowerment, dignity, and overall well-being of Native American individuals with developmental disabilities and their families.